In the name of God, most gracious, most merciful, we would like to welcome the speakers to this press conference of the National Medical Taskforce for combating coronavirus COVID-19. His Excellency Dr. Walid Al-Manaf, Undersecretary of the Ministry of Health, His Excellency Lieutenant Colonel Dr. Manaf AlKhattani, Infectious Disease Consultant at the BDF Hospital, and Her Excellency Dr. Jamil Salman, Infectious and Internal Disease Consultant at Salmania Medical Complex. And we would like to note that this press conference is going live on TV and on the YouTube channel of the Ministry of Health in 5 different languages. And we also have the journalists and reporters joining us remotely. Now, as usual, we begin with Dr. Walid Al-Manaf, Undersecretary of the Ministry of Health. In the name of God, most gracious, most merciful, praise be to the Lord who has held everything within his knowledge. Praise be to him for his countless blessings and grace. And praise be to the Prophet. I would like to welcome you again to this press conference through which we aim at informing you on the most recent updates regarding dealing with COVID-19 in the Kingdom of Bahrain. At the beginning, we confirmed that the Kingdom of Bahrain is intensifying its efforts to protect the health and safety of everyone and accelerating the efforts to bring back the normal life. Well, the work, according to the updates in dealing with COVID-19 locally and globally. And at the beginning, I would like to note of what was announced by the Medical Task Force regarding the reopening of some sections starting from today. The students are now allowed to resume learning at public and private schools, higher education institutions, universities, kindergartens, and also the public rehabilitation centers related to the Ministry of Labor, and also for the private training centers licensed by the Ministry of Labor. And this is optional and will be at the discretion of parents or guardians, and that all the procedures will be taken to provide safe learning environment while implementing the 2 options mentioned. Also, reopening of indoor dining services at restaurants and cafes with a maximum capacity of 30 customers, while continuing to provide outdoor dining services in accordance to previously announced procedures and requirements. Also, the reopening of private indoor gyms, sport halls, and swimming pools in accordance to previously announced procedures. Also, the continuous prohibition of all social gatherings or private events held at home and private locations with more than 30 individuals. And in line with the decisions to reopening these sections, but we call upon everyone to implement all the guidelines and preventive measures issued by the authorities in order to protect the health and safety of everyone and to achieve our objectives. We reiterate our confirmation that protection and vaccination is important. It's going to reduce the spread of the virus and combat it. Bahrain has launched the national campaign for vaccination, and it was among the top countries to provide the vaccines with their various types free of charge. The vaccination process has been activated, and which was recently receiving 300,000 vaccines from Sinopharm, and we emphasize that the kingdom will continue to contact all the manufacturers of these vaccines licensed by NEHR in order to provide them in accordance with the shipments of these manufacturers and to provide them for the citizens and residents and enhance the protection within themselves. The process of vaccination will continue according to the schedules while registering by texting the registers through their mobiles. We talked before about the variant strains, and we emphasize to take the vaccine for those who are mostly exposed, especially the elderly and pregnant women and those with chronic diseases, to take the vaccines in order to protect themselves and their society. And we emphasize that the elderly who are 70 and above can go immediately and directly to the centers to take the vaccines without needing to register for the vaccine. And also for those with chronic diseases, they should take the initiative, especially those with diabetes, rheumatism, and those with weak immunity, and those with cancer, and those with obesity are also included within the scale of those chronic diseases, because the death cases are increasing with those countries with the obesity. So if the percentage is above 25, so the will be more exposed. So we call upon everyone to support these efforts and spread awareness and fully comply with the instructions and guidelines and take the initiative to take the vaccine. Our frontliners who are working 24 hours, they really deserve that we commit to these guidelines and instructions in order to reduce the pressure on them. And the Ministry of Health is continuously working on this. And we point out that everyone should commit to their appointments booked at the exhibition center in order to facilitate the process and make it easier for everyone. And this is noticed by the frontliners. Some people, they might have crowded, and one of the reasons is like people don't comply to their appointments. So by complying to your timings, this will help a lot. And in supporting the efforts nationally, there is a second center established at Sakhir FC Center. So we have 3 types of inspections. Just to remind you, those coming to Bahrain, the first day, the 5th day, and the 10th day, you will have the PCR test. So the third one will be at the Bahrain FC, the Formula One Center, and starting from the 8th of March and will continue until 20th of March. So we emphasize again that everyone should comply to the medical guidelines and instructions issued by the relevant authorities, and hand in hand we're going to combat the virus. And now let's review the capacity for isolation and treatment centers. The capacity at these centers stands at 5,569 beds, of which 1,502 representing 27% of the current capacity. As for those active cases implementing the home self-isolation are 4,750 because they don't experience any symptoms and they meet the specific requirements for this such isolation. As for the recovered percentage is 94.84%, which is thank God, is a very high percentage. As for the death cases, 0.37% of the active cases. To conclude, we emphasize the importance of having the social awareness in order to avoid the spread and to avoid the active cases in order to have our life back normally. Now I'll leave the floor to my brother, Dr. Manaf AlKhattani, infectious disease consultant at the BDF Hospital and member of the National Taskforce for combating coronavirus. Thank you very much, Dr. Walid Al-Manaf. Peace be upon you. Good afternoon, everyone. Welcome to this press conference. Today, we're going to talk about an important topic. Today, we're going to talk about an important and different topic, and we'll review with figures locally the efficiency of the vaccines in real life and how these vaccines reduced the number of the active cases. As we confirmed before, that the mutated virus is spreading quickly, especially among gatherings, and this requires social collaboration more than any other times. There is a relation between the behavior of people and the spread of the virus. So we emphasize that everyone should take the vaccine because it is going to have a good impact on the society and reduction of the virus spread and the protection of society and enhancing the health security. If we need to remind everyone that we are living in related networks, so this is a study for our humanity. So thank God the Kingdom of Bahrain has provided the vaccines for both citizens and residents alike, and they have provided up to 5 vaccines in the Kingdom of Bahrain. And I would like to note that permitting these vaccines are based on comprehensive studies conducted by NEHRA with the collaboration of a number of experts with the clinical studies and the vaccines committee in the Ministry of Health. We emphasize that the variety of the vaccines is based on scientific study and not to compare any efficiency of these varieties of the vaccines. The ultimate objective is to deliver the vaccine to the most targeted people in order to create the herd immunity safely in order to help in reducing the infection and go back to the normal life. We have a number of points to point out. First, the immunity system within the human body is complicated and is different from one human to another. So creating the antibodies will differ from one person to another, and not having them does not mean that the person is not protected from the virus. It is not the only means to measure the response of the immunity. In fact, antibodies are just one of the types of, and there are a number of measures to check the immunity, and we cannot measure them all at once. And we point out the benefits of taking the vaccine. Many people were inquiring about the benefits of these vaccines. We have 4 messages in this regard, the benefits of taking the vaccines. First, the protection from the virus or death, God forbids, and also reduce the complications in the few cases where those will have. Also, it will reduce the percentage of spreading the virus to the other contacts. 3, it will increase the number of those people in society who are protected from the virus, and it will slow the spread of the virus, and it will contribute to the building the herd immunity. And the most important benefit, and hopefully is going to will stop the argument that the stop of this virus and the mutation are the two main means to create any variants. So taking the vaccine will stop creating or the mutation of this virus. Now, I would like to show you important figures of the efficiency of this virus in the Kingdom of Bahrain. Thank God, it has been proven that all the vaccines in the Kingdom of Bahrain are efficient and which are licensed by the Vaccination Committee, especially January and February, by following up 8,414 out of who have taken the vaccine compared to those who did not take the vaccine. So we're going into details later. Just to point out, almost more than 80% of the daily active cases in the Kingdom of Bahrain are as results of the mutated virus, which we call is very spreading quickly, especially among gatherings, and now has become the most viruses in the Kingdom of Bahrain, in the world. This is not something new, because we mentioned before, this virus of corona is mutating, but it can go into different genetic since February 2020. And the best way to prevent it is to take the vaccine to create the herd immunity. There are a number of important points that I want you to focus on. It was based on a study in the Kingdom of Bahrain to study the efficiency of the vaccines. First, the active cases of the mutated virus they had mild symptoms or without symptoms compared to those who did not take the vaccine. 2, in the period between January 1st to 11th of February, the contacts who took the 2 doses, 13.11%. So we had 1,102, and no one of them had a death case. Compared to those who did not take the vaccine, it was 26%. So we had 2,201 active cases, and unfortunately 2 cases were dead for those who did not take the vaccine. So my message here is like the spread, the R naught, and the intensity of the virus was more on those who did not take the vaccine compared to those who took the vaccine. And this is really important, and everyone should know, because if you haven't taken the decision yet, these importance are locally, they are on the ground, they show you the importance of the vaccine, and it will help in reducing the spread and reducing the death cases. And so 8% of those vaccinated were entered to the centers, health centers, to follow up, compared to over 11% for those who did not take the vaccine. So this is important. It shows you that the vaccine is reducing the symptoms even if they have the coronavirus. And let me note that based on the local study in the Kingdom of Bahrain, thank God, this is a great proof that the licensed vaccines in the Kingdom of Bahrain are effective, and through the study it showed that they have efficiency in creating immunity. And therefore I call upon everyone not to wait for a specific company or manufacturer of a vaccine, because as I mentioned before, all of them are providing immunity, and everyone should take the vaccine. And most importantly, those pregnant women, as mentioned by Dr. Walid, to take the vaccine because they are mostly exposed to the issues of coronavirus, because it is spreading quickly, not only in Bahrain but also around the world. Studies have shown that Sinopharm and Pfizer are really safe for this category as per the recommendations of experts in the Kingdom of Bahrain. So please, everyone should not hesitate to register through the Ministry of Health website or the Be Aware app. It is going to be a strong shield to protect everyone from these viruses and to help enhance the immunity to build protection against any viruses. It is going to be one of the fundamental protections. My last advice, I emphasize on implementing all the guidelines and instructions. Thank God the National Medical Taskforce is working 24 hours to reduce the death cases and the problems of this virus. We've provided 5 types of vaccines, so we all should follow these guidelines and never hear to those few people who are spreading rumors. And this is the ultimate objective, to go back gradually to our normal life, which we hope that is going to happen soon. Now I'll leave the floor to Dr. Jamila Salman, Infectious and Internal Disease Consultant at Salmani Medical Complex. Please proceed. Thank you very much, Dr. Manaf. In the name of God, most gracious, most merciful, peace be upon you. I'd like to welcome you all to speak about the most recent updates, especially about the instructions to be followed to reduce the virus. First, as mentioned by colleagues, that the active cases are, as a result of contacts, are at the highest numbers, and this is affecting the daily effects. So at the same time, it's important, really important, to provide the information about the contacts in order to reach out to them and provide the treatment for them in order to avoid the complications or going into any emergency. Also, when we reach them at the appropriate time, it would reduce the spread of the virus in society, because somebody could be infected but they don't have the symptoms. So it's important to reach out to them at a very good time in order to inspect them and have the right treatment. And we call upon everyone to take the vaccine, as numbers mentioned by Dr. Manaf AlKhattani previously showed the efficiency. We have the results in the Kingdom of Bahrain and the results globally as well, which are based on the international studies. They are effective and safe, and we call upon everyone, those who have underlying diseases or they are mostly exposed to these risks. They are the pregnant women, those feeding children, the vaccines proved to be safe, and we don't forget the elderly people who are mostly exposed to the virus, especially the previous variant or the mutated one. These elderly people are also exposed to the complications, and not to forget those with chronic diseases mentioned by Dr. Walid Al-Mana, especially obesity. We noticed in the cases that they are mostly exposed to the virus, and the extreme complications and, God forbid, the death cases will be higher. So it's important for these categories to take the vaccine in order to reduce the virus in society, and they get the protection needed in order to protect themselves from these complications. And we note that you can call 444 whenever you experience any symptoms and take all the guidelines issued by the relevant authorities. Now, I'll review with you the status of the active cases. Those under critical are 61, and those receiving treatment are 111 cases, while 6,191 are stable out of 6,252 general, and we have 123,671 recovered and discharged. So my last point here to emphasize, please comply to all the guidelines which have proven throughout our journey. They are efficient in reducing the active cases and the death cases, and these are the same from the beginning, and they are implemented in all the variants and a mutated virus. In fact, this virus is mostly spreading than the before, so these are simple, washing hands and sanitizing them, social distancing, wearing the face mask appropriately, avoid gatherings regardless of their types, and also be limited to the gatherings of the same family. Also, if we have any people within the same house with chronic diseases or underlying diseases or elderly, we should follow the same guidelines and instructions so we don't infect them, God forbid, with this virus. And to conclude, we hope everyone to implement all the guidelines and instructions, the previous ones, whether regardless of taking the vaccine or implementing the guidelines, in order to reduce the active cases. Thank you. Thank you very much. The speakers now will have the questions from the journalists and reporters who are joining us remotely. We start with Muhammad Al-Nahas from Bawabat Al-Bosala magazine to Dr. Walid Al-Mana. Doctor, it has been announced that some decisions of reopening the gyms, kindergartens, schools, rehabilitation centers, and restaurants, regardless of the increase in the number of the active cases. So what are the factors that you took into consideration when taking this decision? This is among the repeated questions whenever we open or close. So people would ask why you opened or reopened and what are the factors. So I think the medical task force, we have factors and standards. We study them by, to assess the situation, whether to go back or to close. And some of them, I'll just mention to you, like the number, the tests, the death case, the recovered case, the capacity, but there are so many factors that we assess, and sometimes they are directly related to the increase and sometimes indirectly. So there is some time, for example, when we close something, we study, deep study, to decide if we go back and see the impact exactly that affects directly or indirectly on the increase of the active cases. But what I want to remind you, this is a main standard, which is compliance. Compliance has an effective role in opening or closing the establishments. The activities that we reopened were already open, but what has changed maybe the compliance of people. So we found out maybe we closed for 6 weeks, so first 3 weeks, and then we extended them to 3 weeks. So there was a chance for the medical task force to study the impact of the activities, and but compliance is really important. So among the main activities we didn't open yet, which is the parties or the private gatherings of more than 30 people, especially like at home or private places, we've seen that their impact is still existing. So the standards are many, and I want people to rest assured, like we have a medical task force working every single hour to study these, but their compliance is also important, very important, in deciding whether to close or open an activity. Question from Tamam Busafi, Al-Ayyam newspaper, to Dr. Manaf AlKhattani. The appointments for the second dose cough shield were rescheduled to 8 weeks instead of 4 weeks. Is this decision based on medical reasons, depending on the efficiency or the amount of the vaccines available? Thank you for the question. Just to remind you, we always have the decisions issued in the Kingdom of Bahrain based on standards, either locally or scientifically internationally. Thank God, in the Kingdom of Bahrain was among the top countries to provide vaccines, 5 vaccines, and there is no country that would provide such variety. The objective is to fill the gap, but we know there is a difficulty in providing a vaccine from certain types of vaccines. So that's why we made sure that these vaccines are available, they are efficient, and we agreed upon them by international FDA or WHO. So going back to the question, the reason to extend the period from 4 to 8 or 12 weeks was based on a number of studies conducted around the world from November to December. There were in South Africa, Brazil, and Britain. The objective, when one of the countries, European countries, Britain, that 1 dose was given, so it was good to study what if the second dose was delayed, and to confirm we can't implement it on all the vaccines. And they found out that if it was delayed to 8 or 12 weeks of the first dose, it will have the antibodies more effective, 48% more. So that's why the decision was taken, and the WHO accredited this decision to extend the period from the first to the second dose. So it is scientifically studied, not because of to fill the gap. Thank you. Question from Budur al-Maliki, Al-Bilad newspaper, to Dr. Jamila Salman. Have you identified any symptoms with those who took the vaccines, and what are these symptoms, especially like the elderly people? Thank you for the question. Maybe the questions are not symptoms, they are like sidelines, side effects, because vaccines, they don't cause health symptoms, but the side effects are in the Kingdom of Bahrain for COVID-19, they are similar to those other vaccines we took before or for children. Some side effects like the whole body, like they might have like exhaustion, muscle pain, high fever. They might have some digestive problems. These would take 2 to 3 days, and this is as a result of the body responding to the vaccine and activating the antibodies. So this is part of the vaccine. There could have some side effects. There could be some readiness or some pain, but that will fade away within maybe 2 days. But there are no symptoms for the vaccines. As for the elderly people, they are the same. They could be like according to the degrees. Stay with you, Dr. Jamila Salman. Jamal Al-Yaqut, Al Jazeera, to Dr. Jamila. Are the recovered from COVID-19 have the smell and taste back normal as when they were before, or they will take long-term effect of COVID, especially like the mutated one? As for the long-term, including maybe the lack of taste, or we've noticed in a number of patients, and also some other symptoms could take like 3 to 6 months, especially those who are related to the respiratory. We even see like some of the psychological impact, also maybe to the heart system or the lungs. It could take 3 to 6 months. As for the taste, yes, we've seen it, but most would have their taste back after a while. So it's not going to take long, but usually it takes less. Question to Dr. Walid Al-Mani, Rachel Ibrahim, Gulf News. After resuming a number of establishments and activities, are they going to have this finally? Is this going to be final decision? Thank you for the question. Hopefully, this is going to be the last, and we wish, of course, as according to the question, that things would not go back to the closure, but this depends on the data we have. If the data or the factors like we have the less compliance, increase in the active cases, problems, then yes, it depends on the study. Based on so we can't say that we go back or this is the final. We hope it should be the final, but whenever we have a chance that we need to close them in order to have full compliance, this is possible anytime. Now we conclude the question and answer section. Thank you very much to the speakers for your briefs and for answering the questions. Thank you the journalists and reporters, and for you for listening and watching. Kindly be reminded to follow all the precautionary measures and guidelines to mitigate the spread of COVID-19 and combat it. Thank you very much.